When people need dental work, the three most frequently asked questions are, how long will it last? How much will it cost? How long will it take? The answers to these questions depend greatly on which material is chosen to make the repair. We have options of many materials to manufacture dental prosthetics. We have data about these materials showing how well they perform in various roles. Each of them has different physical characteristics which present advantages and disadvantages depending on the role we're asking them to perform. All of them, when used in their most suited roles, perform to a standard so that they are accepted in dentistry as clinically sound patient outcomes. So how do they differ, and what does it mean to patients? Let's look at our choices for filling a cavity, where most of them occur on the chewing surface of a molar. This chewing surface is needed to properly chew our food. That's its number one role. Our choices of materials can be classified by three important characteristics: hardness, appearance, and cost. Physically, the most important aspect of this repair is how we chew with it. Appearance is the least important of the three, as these repairs will rarely be visible. The hardness of the material is most important and should mimic the hardness of the other teeth in our mouth. Like Goldilocks and the Three Bears, some materials are too soft, some are too hard, but one is just right. The softest, amalgam, has been used safely for decades, but is not used much anymore. It contains mercury and is silver in color, but darkens over time. It's just slightly softer than natural teeth. Composite, the light cured tooth-colored materials, are harder than amalgam, but softer than natural teeth, and are the most common choice for patients and dentists because it can be completed in one visit. However, these softer materials deteriorate at their margins over time as we chew on them. They don't harm opposing teeth, but they fail to prevent recurrent decay. Leaking margins are the number one cause for recurrent decay, which is on a 30-year climb. Composite is expected to last on average 7 years, amalgam on average about twice that long. Both can be completed in one visit, while the other options require 2 visits. The hardest material we use, zirconia, is tooth-shaded, but it's 4 times harder than human teeth. Its cousin, lithium disilicate, is also tooth-shaded and almost 3 times as hard as our natural teeth. It might sound great to have something that won't break in your mouth, but it's not that simple. This hard repair will be chewing against your other teeth. In this scenario, the natural teeth deteriorate over time, being the much softer material. In addition, with its hardness comes a brittle characteristic, making it prone to chipping at the margins and again allowing leakage. These are expected to last about 20 years. The best material for this repair is gold. Gold alloys are formulated to stimulate tooth hardness to best fit the role we're asking them to perform. That means it will not hurt our other teeth while we're chewing. It's not tooth-colored, but polished gold onlays on molars usually go unnoticed in one smile. The real advantage that gold has over the other choices is how intimately and enduringly gold seals at the margin. It won't chip or wear away at the margin, it will not break, and it's likely to last 50 years. The upfront cost of gold has been the biggest obstacle to its use. However, if we do the math over the next 50 years, we find that gold is the most cost-effective repair material one can choose. Our choice of material to fill even the smallest of cavities on chewing surfaces can have very different results with very different costs involved. Some materials will prevent further damage and some will not. The emotional choice of tooth-shaded materials is one that predicts further repairs, possible harm, and is only temporary. And each time a repair is needed, it will likely require the removal of more decaying tooth structure or a root canal treatment, costing the patient both physically and financially. There are many more advantages than disadvantages to using gold for molar repair. We cannot say the same for the tooth-shaded materials.